welcome to the recording on pulse points. Guys, here we are going to describe at least 10 pulsation points. So what are pulse points? These are specific areas on the body where a pulse can easily be palpated and assessed. Okay, and the most common one is the radial pulse. This one is located on the inner aspect of the wrist on the thumb side. Okay, this is one of the most common pulse point used to assess the pulse rate. So guys, I know some of us may be having challenges in palpating and feeling the pulse, and I will want to refer you to Oliver Sacks, who said that as a good physician, like a good musician, you have to learn the master of touch. Okay, the master of touch has to be there. And you see, pulse is very vital for us because Lois said that the pulse is the language of the heart. We want to assess how the heart is responding. Okay, so and that's why the pulse is very, very vital. So instruction to take the radial pulse, you place the index and the middle finger at the base of the thumb. Remember, we are going to use the index and the middle finger. Okay, so guys, you have the thumb, okay, then you have the index finger, you have the middle finger, you have the ring finger, and then you have the small finger. So in this case, we are going to use the index and the middle finger. Okay, so we slide down about 2 centimeters in the groove in the wrist, pressing lightly. Okay, so the radial pulse is felt on the wrist just below the thumb, and that is what you are able to get. Remember, the radial artery is comes from the branchial artery. Branchial artery branches into radial and ulnar. So the radial artery is on the thumb side, whereas the ulnar is on the small finger side. Next, we go to number 2. Number 2 is the carotid pulse. Guys, the carotid pulse is what we normally use to assess in adult patients, okay, in case of an emergency. So it's found on the side of the neck just below the angle jaw. The angle jaw is here, guys. The angle jaw is here, okay? Angle jaw is here. So this is how we do palpate again. You're making use of the index and the middle finger. In emergency situation, remember, you should not listen not more than 10 seconds, okay? Immediately the guy is not having a pulse, you start CPR. Guys, a link on how to perform CPR will be popping up. You can review and see how to perform CPR in adult population. So we are saying that carotid pulse is used in emergency situation to quickly assess for the pulse. But in a normal situation, you can take your pulse over your carotid artery by placing your index and the middle finger on your neck on the side of your windpipe, that's the trachea. When you feel your pulse, look at your watch and count the number of beats in 15 seconds. You multiply this number by 4 to get your heart rate per minute. So when feeling the carotid pulse under the angle of the jaw, use very light pressure. Remember, if you do simultaneous palpation of the two, we could result into severe bradycardia. So the third pulsation point is the brachial pulse. Okay, and the brachial pulse is a continuation of the axillary artery at the border of the teres major muscle. Okay, it provides arterial supply of the arm. Yeah. So it terminates opposite neck of the radius by dividing into the radial and ulnar arteries. Okay, so it's located on the inner aspect of the upper arm, typically just above the elbow crease. Okay, so this pulse point is commonly used in infants and children, and this is because of what? Because of the anatomy. We have excess fat in the infant's neck, and also the neck is short, so we can't access the carotid. So instead, in emergency situation for the infants and children, we locate the brachial pulse. Also, the brachial pulse is very important when you are taking the blood pressure. Okay, guys, a link will be popping up on how to take blood pressure. Number 4 is the femoral pulse, and it's located in the groin area, in the crease where the leg meets the lower abdomen. Okay, where meets the lower abdomen. It's used to assess circulation to the lower extremities, guys. Okay, the lower extremities. Remember the landmarks? Here we have the anterior superior iliac spine, the inguinal ligament, then you have the femoral artery, femoral vein, and the pubic tubercle. Okay, guys, a link will be popping up on the anatomy songs. You can review all the 206 bones in a human skeleton. So, to palpate the femoral pulse, you press deeply below the inguinal ligament, about midway between the symphysis pubis and the anterior superior iliac spine. You use two hands, one on top of the other, to feel the femoral pulse. So you note the adequacy of the pulse, you rate the strength of the pulse, yeah, where 0 is absent, 1 is decreased, and 2 plus is normal pulse, guys. Number 5 is the popliteal pulse. Okay, it's found behind the knee in the popliteal fossa. Guys, can you feel your popliteal fossa? Great. This pulse point is used to assess circulation to the lower leg and foot. Okay, so because of the deep position of this artery, its pulsation are best felt in the inferior part of the popliteal fossa. So here the artery is located to the tibia side. Okay, remember we are moving from the femur, that's the thigh bone, to the tibia, that's the main leg bone. Okay, and the fibula. So weakening or loss of the popliteal pulse is a sign of the femoral artery obstruction, and I will keep this in memory, guys. So always try to wrap your hand around the knee so that your fingers are against the soft spot in the back of your knee. Slowly press your fingers into this soft spot until you feel the pulse. Okay, it should feel like a thready pulse once or twice per second. The sixth pulsation point is the Dorsalis pedis pulse. From the Dorsalis pedis artery, okay? Remember, it's close related to posterior tibial artery, which we are going to look at in the next slide. But here, the Dorsalis pedis pulse is located on top of the foot, between the first and second toes. Yeah, you can see the first and second toes. Yes, it is commonly used to assess circulation to the foot. Okay, so this one lies just posterior to the medial malleolus, most readily felt by curling the hands of the examining hand anteriorly around the ankle, indenting the soft tissue in the space between the medial malleolus and the Achilles tendon above the calcaneus. Okay, so you can be able to see how I'm assessing the Dorsalis pedis here. Okay, and the posterior tibial, the one that are going to look in the next slide, forming number 7 pulsation point, posterior tibial pulse. Correct, guys. It's located in the inner aspect of the angle, slightly behind the medial malleolus, the ankle bone. It is also used to assess circulation to the foot. Number 8 is the temporal pulse, found on the side of the forehead just above the temple. So this pulse point is useful in situations where other pulse points are difficult to assess. So guys, we have covered a number of pulsation points: the radial pulse, the temporal, the carotid, yeah, the radial, the brachial, the femoral, the popliteal, posterior tibial, and dorsalis pedis. Let's try and look at the remaining one. Okay, great. Let's start the apical pulse. So this one is normally palpated over the apex of the heart, typically on the left side of the chest. Okay, this is often used in infants and children, or when a more accurate assessment of the heart rate is required, guys. We look for the apical pulse using our stethoscope. Okay, great guys. So it's mid-clavicular. You can identify the sternal notch, the angle of Lewis for the second intercostal space. So in this case, we need the fifth intercostal space, mid-clavicular line. Okay, the clavicle. So we get it here. Okay, so this is the apical pulsation location. Fifth intercostal space, mid-clavicular line. So your pulse is a pulse point on your chest that gives the most accurate reading of your heart rate. It's also called the point of maximal impulse. Okay, so the other pulse are located along other arteries. Okay, but this one is located just almost on top of the heart, on the heart. Yeah, fifth intercostal space, mid clavicular. So the last one is the ulnar pulse, guys, and it's located on the inner aspect of the wrist on the pinky side, pinky finger side. Okay, so the small finger here, small finger. It can be used as an alternative pulse if the radial pulse is difficult to locate. So guys, those are the 10 pulsation points. I like to remind you about an Allen test where we normally compress the two arteries at a go. That is the ulnar and the radius to test collateral circulation. And a positive Allen's test indicates adequate collateral circulation between the radial and the ulnar arteries. So the Allen test tests the presence or the intactness of the collateral circulation. So when the collateral circulation is okay, perfect, we say the Allen test is positive. So guys, thank you so much, and that is how we assess the pulsation points, the 10 pulsation points. Remember, when you are assessing the pulsation points, to note the frequency, rhythm, strength, amplitude, tension or validity, consistency, duration, equality, symmetry, and synchronicity. Okay, thank you so much.